My name is Gabby Tilly, and I'm with California Food Policy Advocates. And I'm going to tell you how the new public charge rule is affecting immigrant access to food and housing. So under the final public charge rule, CalFresh has been added to the benefits that will be considered in a public charge determination. So what is CalFresh? It is the California version of the Supplemental Nutrition Assistance Program, also known as SNAP. Previously known as food stamps, but we're getting away from that now since it's on an EBT card. So you get your money every month on a little card, works just like a debit card. You can swipe it at the grocery store or at some farmer's market to buy unprepared foods. So this, of course, provides resources for food, but in the process of doing so, frees up household income for other basic needs. So it's really successful at getting people to financial security. Even though the average benefit is less than $5 a day per person, even that little bit of extra cash can really go a long way in people's lives. And the federal funding system for SNAP is set up so that it's responsive to need. So for as many eligible people there are in America, there has to be that much funding allotted to give them the benefits that they're eligible for. So that means, you know, some people will say, oh, I think other people need it more than me, or I don't want to take away resources from somebody who really needs it. But that is not true because there's enough for everyone and there's plenty to go around. So when California doesn't take all of the available resources, that's just money that our state misses out on. So it's really important to keep people connected to this program. For many reasons, it's important to keep people connected to this program, the main of which is that it's a really effective anti-poverty tool. The CalFresh alone moved 800,000 Californians out of poverty in 2016. Close to half of those are children. So just that little $5 a day, $100-something a month for a family really can take people above the federal poverty line. So their income is now above and they're not existing in poverty. And of course, it protects against hunger. Having that little money every month will decrease food insecurity by 30%, and especially powerful for households with children. And of course, when you're not hungry or experiencing food insecurity, you have better health outcomes. So we see that people who participate in the SNAP program have better birth outcomes, a higher medication adherence. That's because oftentimes, you know, people are having to make the decision between buying medicine or buying food. So the CalFresh helps people buy food so then they can buy things like medicine. So the adherence goes up. We have higher reports of excellent or very good health. This is also long-term for children that received CalFresh as when they were children. As adults, they report better health than their peers who did not get CalFresh. And there's also less chronic disease. We see lower rates of obesity, lower rates of diabetes, other diet-related illnesses. And of course, that leads to less medical costs, lower medical costs in the end. So it's really important to remember how powerful of a tool CalFresh is, and that's why these programs are worth fighting for, why both immigrant families and all of our families deserve to have access to this program. And also by going over the benefits of CalFresh, we can help destigmatize the program, right? If you might be talking to somebody that's looking to get Medi-Cal, but knowing that they're eligible for Medi-Cal, you know that they're also probably eligible for CalFresh. And people tend to be a little bit more concerned about getting on CalFresh. It seems a little bit more like government help, but we know that has so many incredible benefits for finances and for health. But the more we can explain to people that they're eligible for it, there's plenty to go around, and you really benefit for it, hopefully we can help reduce some of that stigma associated. So there are already existing barriers to CalFresh participation, and this is among immigrants and among the general population. But specifically, immigrants might face some unique barriers that lower their participation rate. So statewide, we have about a 72% participation rate. That's, although people who are income eligible to receive CalFresh, only 72% are actually enrolled. That's nearly 2 million Californians that are missing out on the benefits of CalFresh. And we know that generally the immigrant populations have a lower participation in public programs. Some of the reasons for that could be poor language access. A lot of times Spanish and English are very common languages, but for populations that have a lower population of languages, some of the indigenous languages or others that aren't as common, there's lower access to the materials. So that could be a barrier. There's also confusing and burdensome application and reporting requirements. I mean, this is across the board for anybody applying for benefits. It can be quite a process. So for people that might be a little bit less trusting of government or not sure how things work in this new environment, they might be less likely to complete that process and stay enrolled in these programs. A lack of cultural competence, it comes down to even what kind of pictures are chosen for the pamphlet or who's working at the public services offices. Are they representative of the people who are asking for benefits? Some of those other things might be barriers. Privacy concerns. Even before public charge became an issue, immigrant communities have been particularly concerned about giving personal information away and worried that it might come back to be used against them in an immigration enforcement context. So that those fears are heightened now in this context with public charge. And then, of course, stigma and misconceptions about the program. Sometimes we hear people say, oh, if I get CalFresh for my kids, they'll have to join the military, or I'll have to pay it back, or they'll take money off of my home if I buy a home later. So none of those things are true, but these misconceptions kind of persist in communities passed by word of mouth. So it could be prohibiting people from actually participating. So all these barriers existed before public charge was even a threat. Now that public charge is coming and an increasing threat in the communities, we're seeing even more people afraid to participate. And that's a real shame because truly very few immigrants are eligible for CalFresh and subject to public charge. So the rule actually applies to a very small group. To get CalFresh, you already have to be a legal permanent resident or one of the humanitarian entrants that's already exempt from the rule, like a refugee, asylee, survivors of domestic violence, victims of trafficking, T visa. All these folks are already exempt from being subject to public charge. So it's really a very small group. I think there's one potential category of overlap is somebody paroled into the U.S. for at least a year who, given a change of circumstances like marrying a citizen, might now have a pathway to LPR status. But, I mean, the overlap is extremely narrow. So we can really confidently say to most people that if you are already receiving CalFresh, continue to do so because public charge is not a concern for you. You're already a citizen, you're already a green card holder, you're already one of those statuses that's exempt, so you continue to use benefits. So how will communities be impacted? Of course, when everyone has access to food and health care, housing, the basic things that you need to survive, we are all better off. But when access is withheld, entire communities will bear the weight of increased hardship. So when we talk about people dropping off of the program because they're afraid of immigration consequences but still eligible, that's what we call the chilling effect. So this is an example of an account we heard from our partners at WIC that a client came in and identified as a DACA recipient. She was unable to renew her permit and did not want any government program linked back to her. Even though staff advised her that WIC does not collect immigration status information and does not share it with authorities, she was advised by members of her community not to accept any assistance from federal programs. She said she was very sorry and returned her Symphony breast pump. So these kind of stories we hear a lot from advocates and from enrollers, and it's awful to hear, especially because WIC was not part of the proposed rule and is not part of the final rule, and it's 100% safe to use and does not even discriminate based on immigration status, but we are obviously seeing some people afraid. So to get a better idea of what exactly is going on, we partnered with the UCLA Center for Health Policy Research and the UC Berkeley Center for Labor Research and Education to come up with some estimates of who might be affected and who could potentially disenroll because of the public charge rule. So this is based off of what chilling effect was observed after welfare reform in 1996. So back in 1996, there was the Personal Responsibility and Work Opportunity Reconciliation Act that, tightened public assistance programs quite a lot, added work requirements and several other things. But most importantly, to this context, it limited the eligibility for many immigrants. So people who were used to be eligible got cut off and were no longer. So following that, we were able to observe a chilling effect. Even people who hadn't lost eligibility were still dropping off on the programs, just having heard from the media, from their community, from family members, that the rules have changed and immigrants are no longer welcome. That message was heard loud and clear, even by refugees who were not affected at all by the 1996 change. But after this happened, we saw 60% of refugees drop out of Medi-Cal and or CalFresh, one of those programs. So observed after this was 15 to 35% of people who were totally eligible dropped out of the programs. So based off of that, we can kind of predict what might happen here in California. So here, this diagram you're looking at, the population, the focus of our analysis, this orange section, that's the 15 to 35% of people that could drop out. And the larger blue circle are all Californians in a household with a non-citizen and at least one member who is participating in Medi-Cal or CalFresh or income eligible, so an income below 250% of the federal poverty level. And as you see, the tiny little circle in the center is the actual people that are affected by public charge, which again is really quite small. So we're concerned more about the people who aren't actually subject to the rule, but could leave just because they want to play it safe. So who are those people? Most of them are children from Latinx and Asian families. It's 75% children, the total population of 860,000 people. And this is just talking about CalFresh. This is just the people that might be chilled from the CalFresh program. 860,000. So these are the folks that are eligible but still might drop out. These are the people that we need to get to with the proper information. That maybe if they were equipped with the information that you're learning today, that they're actually not going to be affected by public charge and there's very little to worry about, then they wouldn't drop out. But they just have to get that message from a trusted messenger, could be you, and so that they can make informed decisions. So based off of what we saw after welfare reform in 1996, we can predict that up to 301,000 people might quit CalFresh because of this new public charge rule. That's up to 35% of the whole 860,000, right? But 100% of these people can use CalFresh with no immigration consequences. And this is, of course, we know that from all the benefits that we see from CalFresh, the disenrollment will have negative consequences for their food security, their health, and for the economy at large. But if they just have the information that they need to make informed decisions, hopefully they won't leave. Unfortunately, we are already seeing a decline in immigrant participation. These numbers come from the California Department of Social Services, who administers the CalFresh program, that between January of 2018 and January of 2019, child-only enrollment declined statewide by more than 85,000 children. And so we use this child-only stat as kind of a proxy for a non-citizen household, because we assume that most of these children are enrolled solo because their parents are ineligible due to their immigration status. So that's why we assume that if a person is receiving benefits just for their children, that they're probably not eligible because of their immigration. So this is a pretty good proxy for that. And more than half of these dropouts came from Los Angeles, Orange, Riverside, and San Bernardino counties, all counties that we know to have a high immigrant population. So we also hear this from our CalFresh outreach workers. Here we have a quote from Lorena Carranza at Sacramento Food Bank, who has observed a similar disenrollment trend in the last year or two. And she said that people just don't trust benefits programs. They don't trust the system. They don't trust the government. When one client has a bad experience, they can't stop talking about it. With the new administration, our enrollment numbers are seeing big declines. So while food banks and pantries, WIC offices, and even school nutrition operators, all of these people are starting to notice a decline that really matches the rise of anti-immigrant rhetoric and the rise of anti-immigrant policies at the federal level. So what are the impacts of this kind of mass disenrollment of immigrant communities? Of course, we know that CalFresh has an effect of reducing hunger, reducing poverty, and improving health. So without CalFresh, we expect to see an increase in hunger, poverty, and poor health. Children will be less prepared to perform in school, which affects their future prospects, right? Increased financial stress on families, which can be really harmful for your health and for the future of a child. Heightened risk of chronic disease and mental health conditions. with SNAP participants actually incur 25% less in annual medical costs, so that could possibly go up. And based on how CalFresh lifts people out of poverty every year, it's estimated that the chilling effect could push 280,000 Californians further into poverty just from that disenrollment from CalFresh. And unfortunately, charitable networks really can't meet the needs. Some people think that food banks and food pantries will be able to step up and make up for what CalFresh can't. But one food bank meal is equivalent to what SNAP can feed 12 meals. So it's just a huge difference in capacity. And of course, we like CalFresh because it provides people with the dignity of choice. They have a debit card. They can go to a store of their choosing and pick what they want to eat. So it's much more dignified and really supports not only your health, but your economic well-being. And there's an economic ripple effect, too. So if the health and human argument isn't persuasive, there's a money argument, too. For every $1 of CalFresh spent, that equals $1.79 in local economic activity. That's because, people have money in their pockets that they would not have otherwise had. They're going to the stores and buying things that they wouldn't afford otherwise. So that really stimulates local economies all the way up to the state tax level, all the way up to the national, international levels. So disenrollment from both CalFresh and Medi-Cal, these numbers come from the research that we did on the chilling effect, could mean up to 17,000 lost jobs, up to $2.8 billion in lost economic output for the state of California, and up to $151 million in lost state and local tax revenue. That's huge. That's just from the drop-off of CalFresh and Medi-Cal, that people will have less money to spend, which is bad for them and bad for California. So now I'm going to discuss the housing impact, because housing has also been added to the list of programs considered under public charge. And the new rule adds HUD's rental assistance program, so that's public housing. Public housing is when there's apartments owned by local public housing authorities, owned by the government, that will rent to people for a set level. So that's always less than 30% of your income. Then there's Section 8 housing vouchers. That's when you're given a voucher that you can take to any landlord that will accept it and choose where you live, but you get a little help from the government to pay for it. And then project-based assistance, which is similar to Section 8. It helps pay for rent in a privately owned housing building, but you don't get to choose where you live. So that's like for a specific place, a project-based assistance. So all three of these programs subsidize rent so that recipients don't pay more than 30% of their income on housing. And we know in California, with such a housing crisis, many people are paying more than 30% of their income on housing. I believe it's more than 50% of renters are rent burdened, so more than 30%. And unlike SNAP and Medicaid, funding does not automatically expand to meet the increased need. So like with CalFresh and Medicaid, the government has to fund however many people are eligible. Not so for these HUD programs. So we have generally seen a decline in funding for these programs, and it's just really hard to get into them. So in California, the average wait time for Section 8 vouchers is 38 months. So this is not at all as common of a support as maybe Medi-Cal and CalFresh are. And if you're lucky enough to receive one of these benefits, it'd be really awful to see people chilled out of participating. And like with CalFresh, very few immigrants are eligible for HUD assistance and subject to public charge. There's a very small overlap of these two because you have to be a legal permanent resident or, again, one of those humanitarian visa categories to be eligible for federal HUD assistance. So if you're eligible and you're receiving, you're probably not subject to public charge. So we really want to make sure that people understand that they don't go out dropping their benefits because they're not receiving benefits if you don't have status. Mixed status families. So if you have citizen children or maybe one citizen parent but another who is undocumented, you can still apply for this assistance, but it would be prorated. So you would only receive subsidies for who's eligible. So the undocumented person would not be counted as part of the household, and your subsidy would be reduced to account for that. So under no circumstance is the government ever paying for somebody who's not eligible because of their status. So we can imagine here in California, which has extremely high housing costs and doesn't seem to be getting any better anytime soon, that public charge is going to raise barriers to affordable housing. If you see here on this graph, the change in rent to change in renter income is a very concerning separation starting in 2000 and continuing on. People, and if we look at a chart that's not here, but we can all imagine that wages have also not grown. There's been wage stagnation. So as rents continue to increase, people are not getting paid anymore, and the gaps between getting their basic needs met are increasing. And just like with getting into the programs like CalFresh, immigrants already face barriers to secure housing. Language and education barriers, of course, prejudice and discrimination dealing with landlords that might not want to rent to a foreign-born person or families, and cultural differences. All these things of living in a new place and finding housing in a new place with high costs is already difficult enough. And public charge will only raise those barriers for those people lucky enough to participate in one of HUD's rental assistance programs. And just like health care and food, housing is critical to health and well-being. Without rental assistance, households will be at greater risk for stress, poor health, difficulty sustaining employment when you don't have a stable place to come home to, negative impacts on children's cognitive development, and poor academic performance that results from this instability. And 67% of Californians who receive federal rental assistance are seniors, children, or people with disabilities. So people who are already unable to provide for themselves or face barriers in providing housing for themselves. That's really who the money is going to. And of course also to working families, which like CalFresh is a 77% working families. It's similar for housing supports. So these people are working, these people have families, and they're getting assistance that helps them stay stable. So we should make sure that we encourage people to participate. Very few immigrants receiving food or housing assistance would ever be subject to the public charge test. And we know for a fact that if you are one of these humanitarian status categories, a refugee, asylee, you're a visa holder, you're completely exempt from the public charge rule, and so also can continue using benefits. And a huge one, I think, is that benefits received on behalf of eligible children will not be considered. This is a huge proportion of those who are receiving benefits in California, people who aren't eligible because you have to be a legal permanent resident to get it for their citizen children. 50% of children in California have a non-citizen parent. So this is a huge amount of people who could be getting these benefits. And we know that when people receive food and housing assistance as children, they're better off and have higher outcomes in their health and professional careers when they have these supports as children. So it's really important that we keep people connected. Another thing that we can do is to advocate pro-immigrant policy, right? The more that our state can take a stand and show immigrants that we are actually their support and that it's not a hostile environment, the better that we can make things. It's this hostility and rhetoric of hate that is driving people away from asking for help, driving people out of programs that they previously were participating in. So the more that we can send a message to the immigrant community that California supports this immigrant population and California wants it to thrive. We need to pursue state and local policy change, continue to build coalitions across movements. I think that's been one of the most beautiful outcomes of this public charge, a silver lining, in that housing, health, food, immigration rights, children's rights activists, everybody has moved together to mobilize against public charge and for informing people about their rights. And I think that movement is powerful and should continue and has really positive outcomes, positive opportunities there. And to elevate immigrant voices through storytelling and meaningful inclusion in the work, right? The more that we can get folks engaged and recognizing that this is an injustice and that they do in fact deserve equal access to programs as people who are born here, the more that we can build a movement for, say, health for all and food for all. That would be CalFresh regardless of immigration status. These movements are being built, and please look for opportunities to get involved. Thank you so much. If you have any questions, please feel free to contact me there. And I thank you for your interest in the movement and getting involved to help protect immigrant families. Thank you.